It's you again. Seriously, how the heck do you keep getting in my house? One of these days, I'm going to have to figure that out. But in case you forgot, I'm John, obviously still a Bernie supporter, and it's a good thing I'm dressed because you surprised me. I might not have been dressed. But since you're here, might as well tell you about our corporate-run healthcare and how it affects hospitals and doctors versus Medicaid for all will affect them. There you go, disappearing on me again. Oh yeah, I keep forgetting about those visual slides that I prepared for you. Well, as you're seeing, doctors nowadays must negotiate for services rendered with multiple different insurance network providers. All right, this is very time-consuming and not an easy thing for them to do, and they still can't charge what they want. They have to charge what the networks want them to charge. Obviously, that is anti-freedom, definitely not pro-freedom. Also, doctors are required to pay for extra staff on hand to handle all of the insurance claims, requirements, forms, paperwork. Think about it. Multiple different insurance companies, they all require something different. Obviously, that is not cheap or easy. Doctors also have to ensure insurance companies cover treatments before recommending them. Obviously, if they recommend something and the insurance company won't cover it, the patient can't afford it. So that's not going to be good for the patient or the hospital for that matter, since they're just going to file bankruptcy. Another thing you have to worry about is uninsured people using the emergency room like it's their doctor. This actually makes emergency rooms much more crowded and inefficient, along with being expensive. Next time you go to the emergency room and you got to wait a few hours, you're waiting because of the uninsured people who didn't go to their doctor first. They went to the emergency room. So obviously, that's not good. Uninsured and underinsured people tend to wait till they're practically dying before they get diagnosed or treated for an illness. Obviously, this is going to increase the costs and increase preventable deaths, because if you get treated early, you are much less likely to die from an injury or an illness. So obviously, that's not a good thing either when you're talking about corporate-run healthcare. Oh crap, I see you're back. Well, I hope you liked the first set of slides there. I hope they did a really good job of explaining what I was talking about. Now keep in mind, doctors don't have a whole lot of choices right now with corporate-run healthcare. They literally can only charge what the insurance company is willing to pay them, and that is all. At most, there are 2 networks containing insurance companies in each area, which means literally they have one network or the other to choose from, and that is all. Crap, you're gone again. Oh yeah, you're probably looking at this blue side. Welfare for all, benefits for doctors and hospitals. Obviously, with just the government, they're only negotiating with one entity instead of multiple entities, which makes things a lot cheaper and easier for the doctor there, since they don't have multiple networks they have to deal with. They don't have to pay any staff either to file any type of insurance claims. They literally just file with the government, and that is all. They can also recommend any procedure that they want to, and they do what's best for the patient instead of doing what's best for the insurance company, which obviously is going to be a benefit to individuals. The other thing with welfare at all that definitely tends to be a benefit here is also the fact that patients who are diagnosed early because they go to the doctor early because it's free for them are going to be healthier and cheaper to cure than somebody who waits a really long time. Oh crap, I see you're back again. Well, it's really nice to see that you're still with me. I hope I didn't bore you too much. Well, if you look up here or you look up here, you're actually going to see links to my previous video and my next video. Now, my next video will be comparing how Medicaid for all will actually benefit society versus the corporate-run healthcare we have now. So I'm really glad you stayed with me for the whole video. Please remember to vote for Bernie Sanders, watch my next video, and get the heck out of my house and have yourself a good day. Thanks, bye.